This is Nurse Corey from Synergy Home Care of Arlington. Thank you for viewing this brief educational video on COVID-19. I'd also like to thank In the Know Caregiver Training, as the bulk of this material was provided by them free of charge. Please note the guidance in this video is based upon information we have at the time, is subject to change as more information becomes available. What is happening? Worldwide, as of March 11, 2020, more than 120,000 people have become infected by a new strain of coronavirus known as COVID-19. More than 4,300 people have died. Schools, colleges, and places of worship around the world have closed in an effort to contain the virus. Travel has been restricted. What we know is the first outbreak in the United States started in a nursing home, and that, unfortunately, things may get much worse. What exactly is coronavirus? Coronaviruses are a family of viruses that can infect both humans and animals. The first human coronavirus popped up in the mid-1960s. To date, there are 7 coronaviruses that can infect people. The newest 2019 coronavirus, known as COVID-19, was detected in China first in late December 2019. You may hear the virus referred to as novel coronavirus, novel, new, and corona, crown, named for the crown-like spikes on the virus. Other coronaviruses you may have heard of include SARS, severe acute respiratory symptom, and MERS, Middle East Respiratory Syndrome. Where did COVID-19 come from? Experts believe the newest coronavirus came from an animal in China. Both SARS and MERS originated in bats. Who is at risk for infection? Anyone of any age, race, or gender can become infected by COVID-19. The average age of people with confirmed cases is 56 years old. Older adults who have other medical conditions, such as obesity, heart disease, diabetes, or lung disease, are at higher risk of serious illness from infection with COVID-19. Some facts. The number of active COVID-19 cases grows daily. It's likely people have had the infection without even knowing it. One reason for the increase in cases being diagnosed now is the increase in testing. There is currently no vaccine or cure for COVID-19, but researchers are working hard to make these available as soon as possible. About 81% of people who become infected will have a mild case and fully recover without complications. Older people are at higher risk for more severe symptoms and death. So, should I wear a mask? You should wear a mask if you're a healthcare worker caring for someone with COVID-19, or if you have symptoms of COVID-19. You should not wear a mask to protect yourself in public places. The general public is not advised to use face masks for protection against coronavirus at this time. What are the symptoms of COVID-19? COVID-19 causes a range of symptoms in those infected. The following symptoms may appear 2 to 14 days after exposure. Remember, you may be completely asymptomatic, meaning no symptoms at all. Mild cases present with cold-like symptoms such as stuffy or runny nose, cough, sore throat, or achiness. Some people have reported mild diarrhea. Severe cases include symptoms of fever, cough, shortness of breath, and breathing difficulties that may progress to pneumonia, and in critical cases, respiratory failure, septic shock, multiple organ dysfunction, and even death have occurred. What should you do if you or someone you are in contact with shows symptoms? Contact the office right away if you notice any of the symptoms listed. Attempt to cover coughs and sneezes with tissue, isolate the symptomatic person from others, and seek assistance. We will advise you about next steps, including seeing a doctor and getting tested. For life-threatening breathing difficulty, call 911. What should you do if you show symptoms? Caregivers who have signs and symptoms of any respiratory infection should not report to work. call the office right away, 703-558-3435. Clients with symptoms should also call if able, or call on behalf of your client if they are presenting with symptoms. If you develop a sudden symptom while on the job, immediately stop work, cover your face with a mask, paper towel, tissue, or another item available, such as a t-shirt. Self-isolate away from your client and call the office. Inform your supervisor of all individuals, equipment, and locations you came in contact with. We can assist you in contacting and following local health department regulations. How to prevent spreading the virus. There are 2 ways to prevent the spread of infection. Prevent yourself from getting sick and prevent others from catching the virus from you. To prevent yourself from getting sick, wash your hands often with soap and water preferably. You can also use an alcohol-based hand sanitizer. Avoid touching eyes, nose, and mouth if your hands are not clean. Avoid close contact of 6 feet with anyone who is sick, and practice precautionary social distancing when possible. To keep your immune system strong, get enough rest, eat a balanced diet, and perform some kind of exercise daily. To prevent others from catching the virus from you, stay home from work, school, and public areas if you're sick, except for medical visits. If you must leave the house for a medical visit, call the doctor in advance and wear a face mask to protect others with whom you may come in contact with. Separate yourself from other people in the home as much as possible. In other words, try to stay in a separate room with the door closed. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Preferably, use a clean tissue, then throw it away and wash your hands. Clean and disinfect surfaces you touch frequently, and avoid sharing dishes, glasses, bedding, and other household items if you're sick. How does it spread? There are 2 ways COVID-19 is spread. Person to person. The virus is thought to spread mainly from person to person, between people who are in close contact with each other. Droplets produced when an infected person coughs or sneezes can travel up to 6 feet away. These droplets can land in the mouths or noses or become inhaled in the lungs of people who are nearby. And contact with infected surfaces. Droplets from an infected person can also land on surfaces or objects. When an uninfected person touches the surface or object that has the virus on it, then touches their face, the virus can transfer to an uninfected person. How to disinfect surfaces. In homes, the CDC recommends routine cleaning of frequently touched surfaces: tables, doorknobs, light switches, handles, desks, toilets, faucets, and sinks. Other recommendations from the CDC include wearing gloves while cleaning, preparing a bleach solution to use on hard surfaces by mixing 4 teaspoons of bleach per quart of water. Do not shake linens. Wash towels, linens, and other laundry. Use gloves when available and wash hands after, and wash at the highest temperature possible. Dry completely. If commercial cleaning products are not available, like bleach or disinfectants, use soap and water. How is COVID-19 treated? There is currently no specific treatment for COVID-19, but supportive measures are recommended depending on the type and severity of symptoms. For asymptomatic exposures, the recommendation is to contact a doctor, follow isolation precautions, and monitor for symptoms. In mild cases, contact a doctor and follow doctor's orders, follow isolation precautions, monitor for worsening symptoms. The CDC reports that some observations are suggesting that respiratory symptoms may worsen in the second week of illness. Get plenty of rest and fluids. and medications like Tylenol or Motrin can ease discomfort with mild cold-like symptoms. In severe cases, get emergency help for difficulty breathing. Hospitalization is likely required. Continue to follow isolation precautions, and treatment will depend on symptoms. In critical cases, life-saving measures are required. Isolation precautions are maintained. Managing anxiety and fear over COVID-19. The COVID-19 scare has many people on edge. Its effect on society, such as schools closing, the stock market crash, and declared states of emergency, can cause extreme anxiety. Non-stop coverage in the media, misinformation on social media, and the general uncertainty of where all of this is going can make matters worse. Experts advise that anxiety is a normal, protective human response when your brain scans your body and environment for potential threats so that you can prepare to react if necessary. The problem is that stress and anxiety can easily spiral into panic, and panic is not productive. For people who already suffer from anxiety, the loudest message coming through is that everyone is powerless to an invisible threat that has the potential to devastate individuals, families, and even entire communities. This fear can lead to irrational behaviors, such as fixating on hand washing or wearing a mask when it's not necessary to do so. On the other side of the spectrum, there are those who refuse to see the virus as a threat at all. They may block it out completely, downplay the risk, and even ignore basic advice to wash hands and avoid public gatherings. Both of these are stress-related responses, and neither is productive. Problems can arise when stress spirals out of control and leaves a person to obsess over protective measures or ignore them altogether. The healthiest response lies somewhere in the middle of these two extremes. Stress response. If you or someone you know seems to suffer from one of these stress responses, here are 5 easy steps that can help reduce stress and keep it at a healthy level. First, try to stay in the moment. Anxiety can spiral out of control when your mind begins to predict catastrophic future events. Just know that all you can do is take measures to protect yourself from what is happening right now. You can't predict the future. Are you okay right now? Second, stay informed, but know when to turn off the news and social media. It's important to stay up to date and know the facts. You should tune in for that, but there's a point at which news and social media stop being helpful. You can spend hours listening to headlines or scrolling tweets for alerts, but none of that makes you any safer. Instead, get prepared. Don't feel silly, weak, or embarrassed to follow reasonable safety advice, and ask advice from trusted sources. In fact, feeling prepared can give you a sense of control, which also decreases anxiety. Practice self-care. Get a good night's sleep, eat a balanced diet, and get some exercise every day. These things help boost your immune system and help decrease anxiety as well. Reach out for help if you need it. There is no shame in reaching out to a friend, family member, your doctor, a mental health expert, or another trusted source if you feel your anxiety is spiraling out of control. Help is available, and you are not alone. Here are some myths and facts. Myth: you should stay away from people of Asian descent because they are more likely to have the virus. In fact, anyone, no matter their ethnicity, can become infected by COVID-19. Myth: products shipped from China may contain the virus. Fact: it's not likely that the virus could survive that long on a package, especially after it goes through the extreme temperature changes that occur during an international flight. Myth: a face mask will protect you from COVID-19. In fact, individually fitted respirators, such as the N95 mask, can protect healthcare workers as they care for infected patients. In the general public, a lightweight disposable surgical mask will not protect you from the virus. Myth: a coronavirus test costs $3,000 in the United States. Fact: the U.S. Food and Drug Administration has authorized the use of 2 tests, one from the Centers for Disease Control and Prevention and one from the New York State Department of Public Health. Neither agency charges patients for the test. Myth: vaccines against flu and pneumonia can protect you against the new coronavirus. In fact, neither the flu vaccine or pneumococcal vaccine provide protection against the new coronavirus, but it is great if you've already been vaccinated for those. Synergy Home Care caregivers are valued. Nothing is more important to us than the health and safety of our caregivers. We want you to know that you can reach out to us if you need assistance, and we will do what we can to help you. We are counting on our caregivers to protect the community and to report to us if they or those they have been in contact with have any symptoms or potential exposure to COVID-19. Client communications. Just as we are reaching out to caregivers, we are reaching out to our clients as well. We will notify caregivers and clients promptly of reports of symptoms or known exposure to COVID-19 and ask that you notify us if you have signs of cough, sore throat, runny nose or fever, or you have been exposed to someone who has. We ask that you respond as soon as possible to communications from Synergy Home Care. Your prompt response could help save the life of someone you care about. Electronic methods are the fastest way for us to get information to you, but we will also call if needed. Please look for and respond to our communications. Call 703-558-3435 day or night as needed. Do not delay. Call right away. We care. Synergy Home Care is your partner in providing the most up-to-date information we have available. Our office staff and nurses are here for your questions, concerns, and to support you.